Hey there, Mike Gooden with Reduced Risk Retirement Solutions, where we are certified financial fiduciaries with 20 years of experience helping people keep their money, grow their money, pass their money to their heirs. Today, I'm going to talk all about Medicare enrollment periods and late enrollment penalties and how to avoid them. So let's jump right into it. Because yes, there are penalties for not enrolling in Medicare Parts A, B, and D at the right time. Those penalties can be severe. Some of them can be in place for the entire time you're on Medicare. So it's very important to know when and how to enroll in Medicare in order to avoid those penalties because they can cost you thousands of dollars over the years. Consulting with experienced Medicare professionals such as Reduced Risk helps to ensure you avoid those penalties and that your Medicare benefits are maximized so you keep more of your money. The Medicare Part A late enrollment penalty. If you have to buy Medicare Part A, most people get it for free, and you delay enrollment after your initial enrollment period, you'll face a 10% higher monthly premium that lasts for twice the number of years you delayed. So, example, if you delayed enrolling in Part A for 2 years, that means you're going to pay an extra 10% for 4 years. So important to avoid that penalty. And we'll talk more about Medicare Part A in a bit here. Medicare Part B late enrollment penalty is very real and happens often, and that adds 10% to your monthly premium for each full 12-month period that you could have had Medicare Part B, but didn't sign up. And you pay that permanently as long as you have Part B. So that can be a real killer. The Medicare Part D late enrollment penalty is a permanent monthly fee added to your prescription drug program for each month you were eligible for Part D but didn't sign up and didn't have other creditable drug coverage like from an employer plan or VA. And it's calculated as 1% of the national base beneficiary premium, which changes every year, but it just makes your Medicare Part D monthly premiums a little bit more expensive, and nobody wants that. I mentioned creditable coverage. That is an important phrase when it comes to Medicare. Creditable coverage is a health plan that is at least as good as Medicare. This usually means an employer-based plan, a healthcare exchange plan, an Affordable Care Act plan, or a private health plan through a major insurer. Now, as long as you have creditable coverage, you'll not be penalized for not enrolling in Medicare Part A, Part B, and or D. So what that means is if you turn 65 and you're still working and have health coverage that is at least as good as Medicare, those enrollment penalties for Part B and Part D will not apply, and your initial enrollment period for Part B and Part D will begin 3 months before the date that you decide to stop working or terminate your health plan and lasts for 3 months after the date that you terminate that health plan. That is the Medicare initial enrollment period here at the bottom. It is a 7-month window when you first become eligible for Medicare. For a lot of folks, that's at age 65. And it starts 3 months before the month of your birthday, includes the month of your birthday, and extends for 3 months after the date of your birthday, after the month of your birthday. So in order to avoid the late enrollment penalties, you should enroll in both Part A and Part B unless you have creditable coverage through a workplace plan or a private plan. Medicare Part A, it's very important to just go ahead and enroll in that right there when you turn 65 because number one, it probably doesn't cost you anything. And number two, it coordinates with your employer plan or your private health plan to give you, and it helps absorb some of the cost to that employer plan or your private health plan. So it's always a good idea to enroll in Medicare Part A right when you're turning 65. The Medicare annual enrollment period runs from October 15th to December 7th, and it allows people with Medicare, anybody with Medicare, to review and change their cover during that, what is it, about a 7-week period. And also make adjustments to their prescription drug plan. So folks that are on a Medicare Advantage plan, they can go back to original Medicare if they would like to and get a standalone prescription drug plan, maybe a supplement to go along with it. People that have a Medicare supplement, if they decide that they want to go to a Medicare Advantage plan, they can do that during this time. This is when anybody can make any changes that they want to their Medicare coverages. And then we go to the Medicare Advantage open enrollment period, which goes from January 1st to March 31st annually. And this allows folks on Medicare Advantage plans to make one change to switch to a different MA plan, add or drop Part D coverage, or drop their MA plan to go back to original Medicare and maybe pick up a Part D plan. This period is separate from the main annual enrollment period, and it really only affects folks that are currently on Medicare Advantage plans. And then we have the Medicare special enrollment period, and this lets you sign up or change Medicare plans like Medicare Advantage or Part D outside of the standard enrollment times. And this is triggered by certain life events, such as losing employer coverage, moving out of the service area for a Medicare Advantage plan, stopping your private health plan from a major insurer, or losing eligibility from a special needs plans. There's a lot of things that trigger a special enrollment period, even natural disasters very well. Earthquakes, tornadoes, hurricanes, wildfires. If you have one of these big natural disasters, heck, the pandemic, that did it. Everybody had a special enrollment period during the pandemic. But it will trigger a special enrollment period for you to make changes to your Medicare with no penalties and outside of the annual enrollment period or Medicare Advantage open enrollment period. So how does reduce risk help with Medicare? Of course, we are an independent broker, not obligated to place any individual in any specific plan. We do not work for the insurance companies. We work for you, our clients. We help ensure you get the most benefits for the least amount of dollars out of your pocket and avoid any and all enrollment penalties. There's no charge for our services. The insurance companies pay us to enroll people into their plans. We track each enrollment to ensure plan effective date and verify enrollment. And then most importantly, we act as an advocate on behalf of our clients. So if you're on a Medicare plan and you're having problems with the insurance company paying some of the bills and things like that, you call us and tell us, and we call the insurance company up and we yell at them on your behalf, okay? So it's always great to have a good Medicare professional helping you with your Medicare plans, because the good ones will act as an advocate on your behalf. So after this, you should probably go to the video where I discuss all the different parts of Medicare, Medicare parts A, B, C, and D, what they do, what they cost, and we will see you there.